Hello, hello. And welcome everybody to the next episode of the Health Made Simple show. Yay, love that you guys all jump in early here. So as per usual, say hi, let me know where you're from, and I'm gonna get us set up on Facebook here. Hey. Okay. In a couple of minutes, I'm just going to add this to Facebook, and then we will get started. Hey, g'day, Eric. It's great to hear from you on our challenge call this week. Hey, Sandra. Oh, hey, Elena. I will add you in 2 seconds, and then I'll add you in, and then you'll be able to see yourself. Give me 1 sec. Because we do get questions on Facebook too. Okay. Hey, how are you?
Good. Hold on 1 second.
Yeah, no worries at all. Dr. Bart.
Hello, dear.
How's it going?
Excellent, thanks. Dr. V, welcome, dear.
Hi, how are you?
Excellent, thank you. It's good to see you.
Good to see you too.
And where are you located?
We've been in Denver for quite a while, but I'm an Austinite, so I'm from Texas. How about you?
Well, originally grew up in the Northeast, yet I am now a Floridian. And we're living right on the beach. If you could look out my window about 200 yards, there's the Gulf of Mexico. So
very nice.
Yes.
Very nice. We will probably be up in Florida for the winter. Yeah, so
you'll have to Bart just opened a new organic cafe down there, Elena, so you'll have to go check it out.
Oh, very, very nice. Very nice. I love it.
Yeah. So you can drive. Elena also just bought a huge RV bus, so she's touring.
Yeah, we're actually touring. We just left Denver 2 days ago, and we're in the mountains in New Mexico right now, and then heading over to the infamous Marfa to go check out the Marfa lights and check out the art scene over there, and then we're headed back into Austin, my hometown, for the month of October.
How about that, huh? I love it.
Yeah.
Travel there. Well, welcome aboard. I say we dive right in here tonight. I have so many exciting things, or so many things I have to ask you, and so many things that I know that a lot of our listeners are going to want to hear tonight. But before we do that, I'm going to hand it over to Karen for a minute and get us rolling here.
Yeah, so let's get started. Welcome everyone to another episode of the Health Made Simple show. Before we get started, I want to intro our host, Dr. Bart. So Dr. Bart has been a healthcare provider for over 20 years, practicing a range of modalities, including chiropractic, acupuncture, kinesiology, nutrition and supplementation, and functional testing, all out of his clinic, Balance Health Studio, down in Seagrove Beach in Florida. He's also the founder of the Health Edge program, which is a cutting-edge virtual health program designed for entrepreneurs and executives wanting to take their health to the next level. So Dr. Bart has worked with thousands of people to maximize their health all around the world, including athletes and celebrities. So we are always so grateful for you sharing your time here live on the Health Made Simple show with us. But tonight we also have a super special guest. I'm really excited to have Dr. Elena on the show, who is an internationally recognized crusader for ending the global mental health crisis. We need that so much. We were talking about it earlier, and educating both the public and health professionals that mental health is actually a brain health issue. So Elena's experience is in helping individuals find and address the underlying cause of their depression, anxiety, memory loss, Parkinson's, and other mental health disorders and diseases. So it was through her own experience in suffering severe mental and physical illness where the traditional Western medicine approach had no answers or solutions that she developed a keen passion for the non-traditional approach of holistic medicine. So Elena has also been featured in on multiple occasions on Fox News, MSN, Healthline, Houston Chronicle, and several documentaries where she teaches evidence-based approaches to find and address the underlying causes of depression, anxiety, memory loss, and other mental health disorders and diseases. So we love all of that. There's so much to dive into there. So thank you so much for coming in and being with us tonight.
Yeah, super glad to be here. You're right. This is something that's needed more than ever right now.
Yeah, I tell you what, a topic like this, I think the timing is probably the perfect timing in think of all my career that, for you as well, that right now, with everything that's going on this past year, I know clinically we've seen more mental health, and I can't wait for us to really help I want you to help us define the difference between, if there is a difference between mental health and brain health. That's going to be a real important one. But I tell you, I have 1,000 questions for you. And for all our audience tonight, whether if you're here with us on Zoom, make sure you put the questions right in the chat, and we'll make sure we get to that. And if you're watching us live on Facebook, do the same thing. Put the questions right in there, and we'll make sure we get those answered tonight. Elena, before we jump into any of that, if you would, I'd love to hear a little about your story, because when it comes to mental health, there's this unknown territory. Like, what does someone even do? How do you even go about it? So if you could share a little bit about, where you've been, if you don't mind, I'd love hearing what that journey has been like for you.
Well, I think my journey is similar to so many others who have ended up either with some sort of a mental health issue or even a chronic disease issue. I had 3 practices in sports medicine, and this was about 20 years ago. And I, just like most people, just minimized my symptoms. I minimized the warning signs. Didn't really pay a lot of attention. I mean, to me, having some depression and anxiety was normal because I'd had that most of my adult life. I was a single mom. And so to me, that was pretty normal to have that. I was a single working mom, and then, after working a couple of years, 70, 80 hours a week and trying to take care of him, I was like, I need to go back to school. This is crazy. I need to get my education so I can have a better quality of life and be a good role model for my kid. So that took me down the path of finishing, going back to school and getting my doctorate and finishing that up. And so, I always just attributed my anxiety or my depression to my situation. It was just, it's just situational. Oh, yes, I'm a single mom. Oh, it's because I'm going through my doctorate, like it's hard and I'm trying to raise the kid and all that other stuff. But, eventually it caught up to me. And, I always tell people, it's that perfect storm. It's usually a compounding effect. And that finally it's that last straw that breaks the camel's back. And that's kind of what happened with me too, years and years of, having like minor gut issues, years and years of having situational stress. Yeah. And then with trying to run the 3 practices, and then my father, he was the straw that broke the camel's back. He committed suicide. And this was when I was a couple of years into practice. And that was so traumatic for me, that happened. And my health really came crashing down over the next 2 years after that. And it was, physical illness. It was neurological issues. And then the depression and anxiety just got out of control. And I did seek help. I didn't want to take meds, just like most of us. Like, who wants to take medication for psych meds? Nobody wants to be diagnosed with that. Nobody wants to talk about it, especially back 20 years ago. It was very taboo. You didn't tell your friends and your family, like, oh, I've got depression or whatever, because everybody would kind of look at you like that. And so, I did try meds on and off, but it wasn't helping me. And I kept getting sicker and sicker. And, finally I ended up so sick that I lost my memory. I lost my ability to speak. Couldn't remember my kid's name. I ended up losing all my practices because I couldn't function. And I ultimately lost my house. And, all I ever got from the doctors and and what my insurance would pay for was, well, we don't know what's wrong. Why don't you take this antiviral and take this Xanax and, and then take this Zoloft, this antidepressant, and go home. And I was pissed, right? So that, that combined with me losing everything I had and losing my home, and really believing that I was broken, led me to, want to end my life the way my father did. I just thought, Jesus Christ, I'm not going to live like this. Like, this is terrible. I can't do this. And then there were some divine things that happened to me. And it started me on my journey to realizing that I wasn't broken and that there were answers and solutions. And, I'm still here today. And I have been able to get a full recovery. And we are helping thousands of people to get the same type of recovery. People who, just like me, when they come to us, they'll say, I've tried to commit suicide, or I've been in a mental ward because I tried to commit suicide, or you're my last hope. If you can't help me, then, I don't know that I want to be here anymore. And so this is a serious topic. This needs to be dealt with. We need to change the model of how we're approaching mental health and any type of brain related diseases. Because if we don't, this is going to become the true pandemic.
Yeah, I think, and thanks for sharing that. It's good. I think if there's something right off the front here that I'd like all our listeners to hear is that there's definitely ways to help, no matter where you are, or even if you think your thing is isolated. I promise you that there are so many methods and proven techniques now that are used that help people get healthy. So if you're listening to this and you feel like you or someone you love that's got something going on, make sure at some point you do reach out, because there's definitely opportunities. I was just talking to Karen before we got on here, and twice today I had, in my clinic, I had two random situations that the people weren't even in for these situations, for the anxiety, for the depression, but they showed up. So, what I'd love to do is, maybe for our listeners here, maybe we could start by just talking about some of the symptoms that are almost like the precursors that people don't really connect. So, and then I think there's also a little disconnect here. So our whole goal always is to help make health simple for all our listeners. So I think there's a disconnect here. And I think as practitioners, we understand this disconnect, but I don't think everyone always understands that we categorize like mental health. And we think, oh, that's anxiety and depression and nervousness. And then we talk about brain health as if they're separate. And then we think about all the things that happen with our brains. And maybe we're thinking like Parkinson's and those types of brain diseases. Could you make a comment for a moment about the relationship that these all have together?
Yeah, well, mental health implies that there's something wrong with you. Mental health implies that, you have some sort of a problem with the way you were born, or your genetics, or it's in your genes. It's implying that you're broken and not fixable. And that's absolutely not true. And that's why I like to differentiate or really redefine what this really is. It's not a mental health issue. It's a brain health issue. Your body and your brain are designed to work and to recalibrate themselves. Your body knows how much serotonin to make, how much to break down. It knows exactly what the right balance of dopamine and GABA and everything else that it needs. And just like with any other organ system in your body, if your brain isn't functioning properly, there is some sort of barrier to healing. That can be mold toxins, heavy metals, environmental toxins. It can be heightened emotional experiences that have literally rewired your brain. Usually it's a combination of all of these different things that we find. But I think it's really important for us to differentiate and to start learning to throw away the term mental health.
Yeah, I think that's great, and understand, like, more shifted into this mental health comes from my brain. And if the brain gets unwired or rewired in a way that doesn't serve us, obviously, then we have to go back to the brain, not necessarily just that emotion that's taking place here. So, but let's dig about. I think let's dive a little bit deeper, and let's just talk about those emotions for a second, because I think sometimes they're so misunderstood. Things like the diagnosis of anxiety. Oftentimes, people think they caught something, or that there was a genetic thing there, or depression for that matter, when really clinically those are really descriptions of, like of things that are taking place here. What do you think? And we'll probably end up diving into a lot of this, but if there was one thing, and I don't even know if this is a fair question, that is at the root cause, or maybe not even the cause yet, but what is one of the first things that we would start to see as a symptom?
And you had asked that a minute ago, like, what are some of the symptoms that people like just have no idea that could be a precursor to them developing anxiety or depression, or, or both, or schizophrenia or bipolar or anything else like that? That's really important. So let's talk about that for a minute. We have been raised in a health model, which is really a sickness model. There's nothing healthy about it. That's why we are the sickest industrialized nation in the world. And that's why, we are, we have the most expensive care in the world, because it's a reactive care. It's not a proactive care. People can start having symptoms from childhood of gut issues of all things. And how many people realize that your gut is really tied to your brain? Other symptoms could be, if you're not sleeping well, that could be another one. You don't always have a lot of other symptoms prior to the symptom of anxiety and depression showing up. But those are a couple of the things that you might notice. History, though, a lot of things in the history can give us a lot of clues as to, if you may develop it, right? So history would be things like, do you eat organic or do you eat conventional? Conventional meaning non-organic. Do you live in a farming community where there are crop dusters and other equipment spraying pesticides all the time? Do you take medications? And, there are many medications that can really disrupt the brain chemistry and disrupt the gut biome. And a lot of your brain chemistry is made in your gut. In fact, most of your serotonin and dopamine are made there. So you could have all the right ingredients for your body to make dopamine and serotonin. But if your gut is a disaster, then you know what? You're not going to be able to make your brain chemistry. So have you taken antibiotics? What other types of medications have you taken? And foods. What about your foods? Your foods can really cause a huge problem. If you have certain types of gut infections, if you have different types of bacterial infections like, C. diff, for example, H. pylori, those can cause massive panic attacks in people. And parasites can do that too. And so, there are multiple underlying causes that can cause a shift in brain chemistry. More times than not, it's a combination of these multitude of underlying causes that we find in individuals. We almost never, in fact, I can think of one. I can think of one instance where someone had literally one underlying cause. And she was a lady in her 60s, still surfs. She lives out on the West Coast in California, and she's never had a history of any kind of health issues, mental, physical, or otherwise. And 2 months prior to her finding us, she started having panic attacks, brain zaps, like she felt electric like shocks in her brain. And she was having heart palpitations because her panic attacks were so bad. She was having sleep issues too. We found that she had a massive H. pylori infection in her gut. Massive H. pylori infection. It's the only thing we found. We got rid of it in 8 weeks, and we also got rid of her anxiety and her panic attacks and brain zaps and everything else. But that's so rare to only find one thing. There's usually a compounding effect of a multitude of different things that end up leading to either a mental health disorder or a neurodegenerative disease.
Wow, a lot right there. So I want to pick a couple of these apart little bit by little bit, because again, I think this is one of those categories. I've been practicing 20 plus years, and it sounds like you have been as well. And the first 10 years of my practice, I don't think there's ever a conversation about this. The last 10, 12 years ago, we started to see more conversations about anxiety and stuff. And I remember probably about 12 years ago, I went and I studied Chinese medicine and became an acupuncturist. And I remember real specifically a way of doing a physical evaluation and things to be looking for and listening for in terms of seeing if someone has brain dysfunction, lack of chi in their brain, AKA anxiety, depression. There was 3 things that stood out for the longest time. And it showed up in my clinic today. It was by observation. I'll share them with her, kind of neat. And the first one, we called it weak words. When someone just doesn't have any chi behind their words, they don't have any power. They're almost like hiding. The second was posture, a feeble posture. And then the third was some visual type of shaking. And that was where it's interesting. I think we've all witnessed someone go to hand you something and their hand's shaking a little bit. And you're like, I don't think that's normal. But somehow we just don't talk about this. But it could be other shakes, like they bounce their knee, there's a nervousness, there's something going on. Well, people don't realize that so many of those things go back into the brain. So that's just kind of a physical observation that sometimes we can have of precursors. And I say that because for my moms and dads out there right now, that they can observe these things going on early in their teenagers, early in their kids, and they start to see these habits. This is the time right here. Don't guess, don't wonder if it's going to take place 10 years down the road. This is a now thing. So Dr. V, I want to go back to, there's really a couple things, food, and I want to go to the medications for a while. And listen, you and I, we're not diagnosing anyone here tonight, but I do want to talk about medications here. We're not acting as one doctor, and everyone knows that. But there are medications right now that are getting passed out like candy. In fact, people use them. They're mind-altering Schedule II, Class II drugs that it is common. Things like Ritalin, things like Adderall. Talk to me a little bit about that and our people, everyone watching tonight, because unfortunately, listen, I know that all medications have a place. I get that. But not the place that I see they're being used on a regular basis. Can you speak to those directly? Because I'm sure you see them all the time as the precursors.
Yeah, absolutely. In fact, the majority of the people who come see us are on a multitude of medications. Usually they're on at least 2 psych meds, if not more. By the time that they come see us, by the time they're finished with us, they're off of everything, even if they've been on them for 20 years. The reason why people are on all of these meds is because that's the only solution that these doctors have. Mental health and neurodegenerative diseases is the only segment of medicine that is not evidence-based. It means it's not data-driven. It's only based on a set of subjective symptoms, like what the client is telling them how they're feeling. And the only solution that doctors are taught, whether it's an MD or a psychiatrist, is they're taught, well, if they present with these symptoms, then, here's a set of pharmaceuticals that we can give. And, rather than saying, well, they're having this set of symptoms, what are all the underlying causes that we know that can cause these symptoms? Is it parasites? Is it chemical toxins, heavy metals, gluten, dairy? What are these different things that can cause that? They stop at the symptom and go, oh, well, here, take this medication. And that's where we at Modern Holistic Health have become educators. You see, we don't just educate the public. We are educating and we're teaching other doctors. We have medical doctors, DOs, nurse practitioners, psychiatrists, psychotherapists, chiropractors, or, other functional medicine doctors. And they're coming to us and asking us, how are you doing this? Will you please teach us this evidence-based model? And so, we are teaching health professionals as well as the public, how to approach any type of brain-related issue, using data points and really understanding all of the different facets of the human condition that can lead to brain-related issues. Medications can definitely be lifesavers. There definitely can be lifesavers. I remember when I thought I was having a heart attack during these years when I was really sick and I lost my memory and then I couldn't speak. And I remember one morning I woke up, I thought I was having a heart attack. I was so upset and scared because I was losing my memory. I was sick. I couldn't talk. I mean, I literally thought I was having a heart attack. It was a panic attack. I went to the hospital. It wasn't a heart attack. It was a panic attack. And they did put me on some medications. And the other thing that happened, because I was so stressed out and scared over what was happening to me, my blood pressure was like 190 over 160, and the doctors couldn't believe I was alive. And this was in my 30s. And it was all from stress and fear that my blood pressure went up like that. So they put me on an anti-anxiety, anti-depression medication that took effect fairly quickly because they added Xanax to it to calm me down. And you know what? It was a lifesaver for me, but it was not a solution. It wasn't fixing the underlying causes of my issue. So medications, yes, they save lives all the time, but they're designed for short-term use. They're not designed for long-term use. And that's why once people get on these medications, when they try to get off of them, they usually notice that their problem is still there. It's because they never fixed the underlying problem to begin with.
Yeah. So speaking of the underlying problems, I think I've gone on record multiple times saying that, this whole COVID thing, we don't have a virus issue. We have a poor health issue. We have a diet issue in our country. We have blood sugar management. We have a carbohydrate sugar issue. So let's back up a little bit about food, because I don't think we connect those enough. And again, for all the listeners tonight, that's something I'm hoping you really take away from tonight, is that there's a direct connection here. And it's clear as day for a lot of us that are practitioner observing. When you have things like anxiety, depression, the more carbs and sugar you eat, if you have anxiety, it spikes. You have depression, it buries it. And so let's back up a little bit. How important in your clinic, let's say you have 100 clients, how many of those 100 are you altering or redesigning their nutrition?
100%.
Yeah.
100%. Even if a person comes to us and says, well, I'm eating clean. Clean can mean different things for everybody. For example, we had one client who said, I'm eating perfectly clean. Everything I do is organic. I'm sugar-free, dairy-free, gluten-free, and I don't even eat anything with lectins or nightshades or anything like that. I'm doing everything right with my food, so I don't need help with that. And I said, well, let's do some testing and let's just see what comes back. Well, it turned out that she had some major food sensitivities to a couple of otherwise healthy foods, celery being one of them. She was drinking celery juice every single day, and it was causing a long-term big inflammatory response. She had no idea that it was causing that, right? She just knew she didn't feel good. And she had leaky gut. So a lot of the foods that would normally be considered anti-inflammatory and healthy and brain boosting and all of that, she had a handful of those that were actually causing her more harm than good. Once we were able to determine that and figure out, that these things she was eating were leaking out of her gut and going into her bloodstream and causing an antibody response, which ended up with inflammation in her body and her brain, we were able to go in and we were able to heal her gut up. That was one of the many things that we did with her. We will change food with everybody. And what individuals need to eat really can vary from person to person depending on what's going on for them. Food is everything. Food is either your medicine, it's your best form of medicine, or your slowest form of death. It's your slowest form of poison. And, we have even seen individuals who have been diagnosed their entire life with schizophrenia. And it turned out that it was a gluten issue.
Mhm.
And frankly, I think it's medical malpractice that we have the model that we have when it comes to mental health, because this person's life is ruined because she was diagnosed with schizophrenia at age 12. She's now in her 50s and she's done nothing with her life except go in and out of mental institutions, and she's still living with her mother. And finally, we figure out what the culprit is. She starts getting better, and now she's got a whole nother layer of depression and stuff to deal with, because now she's so angry that she lost her life because of a misdiagnosis. You know, I mean, food is everything. And believe it or not, people don't want to believe that gluten could do something like that, but it can. It can lead to a person being diagnosed with bipolar, schizophrenia, attention deficit disorder, defiance disorder, all these different things. And there are many times when it could have just been a food that was the culprit, like gluten or sugar or dairy or something like that.
Yeah, your story rings a bell for me. A couple years back, I had a young girl who was in the office, and she suffered from depression, and she was on medications, and and we had a great rapport over the years. And I finally it was random. We were looking and looking, and finally I ran a parasite test on her, and sure enough, comes back and multiple parasites. And it was an interesting moment. And I think, and this is really why I want to share this with the audience tonight, that in that moment, she's on her medications and she was scared to death coming off her medications, literally scared to come off of them. And I said, no big deal. We can increase your health, make it an and world for a moment, and let's build you up. And then when the time is right, you'll figure out if you need to come off anything. And sure enough, and you know how quick we can get rid of parasites, 30 days, it was as if she was a new woman. Like literally her skin, it was crazy. Her skin cleared up. She cleared up. Like she was speaking differently, walking different, carrying different. So again, it's just one of those things where there's so much that if we have the time and the effort, or can find the practitioners that understand looking for the root cause, adhering to and listening to the symptoms, but understanding the bigger picture there. So I want to go back to medications, or really not medications for a moment, because right now, I think that these last 5 years, we have seen such an increased volume of marijuana use. So I've been involved in the sports world forever. And a lot of what I used to work with was professional fighters. And it was to surprise people, but a lot of the professional fighters dealt with a fair amount of anxiety. You imagine they're about to go and get into a cage with someone and fight. And oftentimes, just habitually through their careers, they would use marijuana to help themselves with anxiety. And as their coach, but also as their doctor, I discovered that the more they used it, the worse it got. So I'm guessing that right now you've also seen more widespread use of marijuana. And I know this is a popular topic, and sometimes people don't even want me to even mention this, but it needs to be, because this is having an impact. And it's not all roses when it comes to marijuana. Do you have any input on that? You want to pass on that one, or do you want to have any comments?
You know what? Nothing's off topic. Let's talk about it, because this is real and a lot of people are using it. Marijuana, it's considered, one of the plant medicines out there. And I'll tell you what, it's got its place. It doesn't fry your brain like we all learned back in the 80s. There's so much lying done to us about plant medicine, like psilocybin from mushrooms, or, marijuana. But there's a time and a place to use it. And that's where we just need to be able to educate more people on, how to use it. There are a couple of main strains of marijuana. One of them in an indica strain. The other one is a sativa strain. And many people that have anxiety, many people do find that either a blend of the two with CBD really helps to calm the nervous system. And then you have other people who really just like the indica blend with some CBD because it helps calm the nervous system. But think about it. It's a medication. It's not fixing the underlying problem. So of course you're going to feel better when you take it, kind of like a Xanax. The difference is that Xanax is very addictive and can cause a whole bunch of other issues, including rebound anxiety, meaning that your anxiety gets worse when it wears off. The marijuana doesn't typically do that. Now, again, when we're talking about these plants, remember that it is like medicine. So, if you don't fix the underlying problem, when the marijuana wears off, the anxiety is still going to be there, right? Because, you didn't really fix it. It just calmed the nervous system. The other thing too, to understand is that, there are different sources of it. And just like a lot of other crops, there are people who spray their marijuana crops with glyphosate, another pesticide. So, you could be causing another bigger problem on the back end with your mental health and your physical health, because, at the moment that you're smoking that indica, or, taking it in a gummy form, or whatever you're doing with it to calm yourself down, you're using it as a medication, it's calming you, but you also just stuck a whole bunch of glyphosate in your body, and there's a cumulative effect of that. And at some point, it is going to start causing a bigger long-term issue with your brain and your other organ systems as well.
Yeah, I think that's a great way to kind of share with our audience that's perfect. Where you listen, marijuana is an herb, like it's a plant-based medicinal option. I think the challenge can be is when we use it to continuously mask up something that root causes. And I think that's the big message that, I think everyone that is using it to cover something up. There's other herbs, there's other medications just to get rid of that symptom at time. Karen, do we have any questions we want to tackle for a moment here?
Yeah, we do. We've got a few questions here, and then we've got a few questions from Facebook too. So let's do a couple of questions. This one from Bethany, kind of a question statement, but she says the most difficult part of mental health difficulties is having the ability to get to the root cause and why patients are experiencing their given is having the ability as a clinical to get to the root cause of why patients are experiencing their given problem. So, I mean, it can be difficult for these people to find someone who can get to the root cause.
Yeah, that's absolutely true. And until we saturate the population with the education that they need to understand and learn that there are evidence-based approaches to find the root cause, then we're never going to see that seesaw teeter. We are disrupting the industry, so to speak, because we are teaching these evidence-based approaches. And I'm not the only one doing that. The Integrative Medicine for Mental Health, the IMMH conference, is a big conference every year. And there are doctors and scientists that come in from around the world to speak on these evidence-based approaches to teach other doctors. And not only have I been there to listen, to be there as one of the attendees, but this year I had the privilege of speaking at IMMH because last year I noticed that there were some amazing doctors. You had, Daniel Amen, and you had Dr. Bredesen, and these other doctors that are teaching these evidence-based approaches for mental health. But what I noticed was that they were all getting up and talking about one topic. So they were very, very focused on Clostridia and how it affects dopamine conversion in the brain. And then you'd have another doctor talking about gluten, and then another doctor talking about mycotoxins. And at the end of each talk, I would listen to all these MDs and psychotherapists and all these people that were there that were fascinated and want to learn this new model, because this is not taught in school yet. And they were all trying to put the pieces together. And they were so confused and so overwhelmed and amazed and in awe and excited about, wow, we can really help people. And so this year, as a speaker, I came in and I put all the pieces together. And I showed them all the different underlying causes, how you address them, in what order. And so you're right. Not everybody knows that there are different approaches. But in our mental health masterclass that we have, it's a free 5-part series. And in that, we are teaching the world about these evidence-based, data-driven approaches. And we even show a lot of case studies in there as well. So I would definitely encourage, you guys to watch that and share that with your friends, because the more people that watch this, the more people can learn. And it's not until we have that knowledge that we can stand up and we can be the change that we want, not only in the United States, but around the world.
Yeah, that's amazing. And I'm going to put the link to that masterclass in the chat here. And we're going to put the link to that masterclass in Facebook as well. So if you're on here, definitely go check it out. It's a free masterclass, right? They can just click on the link and get access.
Yes, anyone can get access.
Yeah, awesome. Okay, so the next question is from Eric. Should a person with autoimmune problems like psoriasis get an allergy test?
Yeah, but probably a whole lot more too. So, you know, typically when we see issues, skin issues, there is usually a toxic load on the body. There's usually some sort of toxic load on the body. But in addition to that, it's not uncommon for us to find that this individual also has progressed into leaky gut, and they have developed food sensitivities. That's different from a food allergy. If you have a food allergy, you're gonna know you've got a food allergy, right? I mean, it's so funny that all these years people will go get tested for food allergies. Trust me, if you've got one, you know it, right? If you eat a strawberry and your lips start swelling, you've got a food allergy. Stay away from the strawberry. The same thing goes with peanuts. Sometimes these food allergies can develop as you get older, but you typically notice it. What people don't notice is when they have food sensitivities. A food sensitivity is going to cause a slow, long-term fire in your body. So this inflammation, it doesn't happen right away where you notice it, like, oh my God, I just had that glass of wine and I've got hives. Or, you know, I just ate that banana and now like the back of my throat is itching now. Like that's very obvious. But these food sensitivities, they start creating an inflammatory response, usually 2 days to 3 days after you've eaten it. And it's this low level inflammation. But when you're eating it all the time, that low level inflammation becomes higher and higher and higher. And it's not just causing inflammation in your gut, it's causing inflammation in every organ system in your body, including your brain. You know, if you have a skin issue, I would do more than just a traditional allergy test.
Yeah, for sure. And really with things like this, as you were saying with some of the things that you're dealing with, there's potentially multiple causes or things we need to look at. So really, you know, if somebody has an autoimmune problem or psoriasis or the anxiety or depression or something, they really need to find a practitioner to be able to dive a bit deeper and get to the root cause.
Yeah, and, you know, I can just add here too that, you know, whether an individual manifests their health issues as a brain-related issue or an autoimmune related issue, the underlying causes are typically the same.
Yeah.
How you manifest your disease depends on your weak link in your chain. In other words, what's your environment like? How are your genes responding to your environment? What are you doing to your body? Are you running it into the ground? You know, what are you doing that is allowing your body to, you know, manifest in that particular way? And so whether it's an issue like psoriasis or Crohn's disease or a mental health issue, you know, or MS or Parkinson's or whatever, typically we find the same underlying causes. Just how you ended up manifesting your symptom, your warning sign, can be different from the other person, can be different from the next person, even though you got the same underlying toxins or infections or whatever.
Yeah, no, sure. Okay, we have some more questions here. So this one's from Helen. Benzodiazepam tapering is my biggest problem. I don't know that I'm in the, that's her question, sorry. Then she's like, I don't know whether I'm in the right place for this to be addressed, but you are in the right place, Helen, I believe.
Yeah. So benzos, that's one of the things that makes benzos so dangerous, is that you can have a bigger issue when you try to get off of them. You can have a rebound effect. The benzodiazepines can be very difficult to get off of. What I would suggest that you do is go work with somebody, find somebody who does this type of approach, okay? And that can be us, that can be, you know, other people. And let's figure out what underlying issues that you have going on before you try again to taper off. A lot of people try tapering off their medications before they ever fix the underlying problem that caused them to get on the medications in the first place. That would be like taking your cast off and throwing your crutches out the door before your leg has healed, you're going to fall back on the ground. You're going to cause more damage to the, to the structure of your leg. Like, allow the leg to heal before you take the cast off and then finally get rid of the crutches. And, if you're trying to do it on your own and you're really, really struggling, get someone who knows what they're doing so that they can help you to get off the medications. You can get off those medications. You probably have some other things that need to be addressed before you try getting off of those again.
Yeah, for sure. And there are, both of, Dr. Bart, Dr. Elena, both of you work with people virtually all across the country. So if people do, are looking for a practitioner and can't find one in your area, correct? You both work with people virtually across the country.
Yes, we do. We work with people internationally as well. So, distance isn't really an issue.
Awesome. And we'll also add the Balance Health Studio details in there, and we'll get your details from you, Elena, too, and we'll add it in the show notes so everybody can have a place to be able to go and connect. Yeah, we've just added the Balance Health Studio stuff in the chat. So the next question is, as parents of 2 teenagers faced with virtual learning and social distancing since March, how can we help our children work through the mental challenges they are facing? Loss of interest in school, lack of normal social interaction with friends, depression, extra screen time, negative influences, and more they are dealing with. This generation we are raising has many tough challenges. What tools can you suggest for us parents? From Emily.
Yeah. You know what? That's a multifactorial question, really, and it's a multifactorial answer. But the first thing that I would think of is, what was the home life like? What was the school life with the kids before this?
Yeah.
Right? Because, if you could rate it from, 0 to 10, with like 10 being the best, like they were loving school and straight A's, and they were, actually connecting with their friends and connecting with you guys, and, having a healthy family life too at home, then, they may have gone from a 10 being like perfect, maybe down to a 6 or 7 right now, right? Because there's been a lot of craziness going on. If they were already at a 6 or 7, kind of struggling, but everything was okay. You just kind of keep things glued together, and I just keep pushing the kids. They're going to get through their rough time, whatever. And then this happens, this big wave. They might be down at like a 2 or a 3, really struggling, trying to stay afloat right now. So, I would go back and reevaluate what was life like before this happened. Really, what was it really like? And little clues that you can go back to, and like what Dr. Bart was saying, did they were they already having issues communicating? Did they seem confident in their communication? What was their body language like? Were they struggling in their social, with their social life prior to this? And then, now, I would say, like, yes, there could be some, underlying things, like kids get parasites all the time. Everybody does. If you think that because we live in the US, you don't get parasites, you are sadly mistaken. The kids could have some sort of parasite, bacterial infection. Hey, I grew up around horses. When the vet used to come and deworm the horses, he'd put all the kids in line and give us a squirt of the same stuff he was giving the horses. Seriously. And I swear I could see, like, sometimes worms coming out of my poo when I was a kid. I thought it was just fascinating. Nothing ever scared me. But, so it's like, it could be parasites. It could be a food that the kid is eating. It could be something as crazy as, like, food coloring in their Kool-Aid or in their gummies that they're eating. There's a lot of things that if you sat down with me and you talk to me about the kids, we're going to start diving into every single facet. What is going on? And it's probably a combination of different things. And then, in this case too, like, how much TV have you allowed the kids to watch? Because, mainstream media has done an excellent job of inundating fear, indoctrinating fear into people. And if the news has caused you anxiety, imagine what it's doing to your kids. And if you have anxiety, your kids are connected to you. They're going to have it too. If you're stressed out and you're depressed, your kids are going to be there too. They're going to be right there with you because they're connected to you. So there's a lot of different things, right? I would want to sit down and start putting all the different pieces together and see what things are contributing to your kids not having that vitality and that happiness that you know that they should have.
I think that's awesome. And thanks for going to that depth, because really it is multifaceted. So a conversation I'm having a lot with my parents right now about this whole thing, because it's different. And I put it in this phrase, saying if they're going to change the rules, we have to allow ourselves to change the game. And what I mean by that is, listen, the reason all of this has gone upside down is because of health, period. So let's let our children win at learning more about health. So the old game was, the rules were, you go to school, you get some homework, whatever. You sit in class, you obey, you go home, do some homework, and you get a test. And that was the game. And now the game has to change because the rules have changed, because now you're at home. We need experiential learning. We need things that kids can dive into. And the most powerful thing right now, because the reason the world is an epidemic right now is because we don't have any health education. So I would encourage all the moms and dads out there, make a game out of this. Learn a little bit about their health. Have fun, learning about their diet. Maybe get into a garden or something like that. Because if we don't raise the bar, if we sit back and don't help our kids become educated right now, we're missing it. Like, we're totally missing it, because the world is an epidemic because there's a virus going around, it's just mind-boggling all in all. So and I think, just to kind of compound what Dr. V said, multifaceted. We have to really look at so many different angles here and be willing to, and have fun doing it, because each time we have that little angle, it helps us level up just a little bit more, which is cool. And it doesn't have to be overwhelming. So I know some of the moms out there, and I'm sure, Dr. V, you experienced, the moms are like, there's no way I'm going to get my kids to, eat vegetables all day long. And that's okay. Like, we can start small and move in the right direction here. So, all right, Karen, we got any other questions before we get wrapped up tonight?
Yeah, this one kind of leads on to the other one, actually. Dottie asks, how is it best to support and encourage without enabling someone who could bolster their own mental health, or someone who's close to you, I guess, that's suffering with some of these things?
How can you best support them?
Yeah.
You know what? Share this mental health masterclass with them. Yeah. I set out last October. I remember having a conversation with my husband. Of all of the conditions that we see and help people with, anything that's brain related is so passionate to me. And I'm sure you can see that coming through the screen here. It's because I almost died. I almost lost my life. And now I've got a 28-year-old son, 2 grandkids. And every day I'm like, thank you, God, that you intervened and showed me that I was not broken. And, the best thing that you can do is to let them watch this masterclass. When I started this idea last year, I told my husband, I said, people just need to get educated. I just need to just give them some education. And I just want to put it out there. And what started out as that was going to be a 1-hour, presentation that I was just going to put out there to the world for them to just hopefully catch on YouTube, turned out to be a 5-part series. That's how much education is in there and how much hope is built into that, so that people can see other case studies, Parkinson's, Alzheimer's, schizophrenia. I actually put case studies in there so that you can see that people just like you are not broken, that there are answers and there are solutions. If you want to support your friends and your family, and we all know people who are struggling. If you want to support them, share the masterclass with them. Let people watch this. This can help turn people's lives around.
I think one of the biggest things that's powerful about those case studies, all the things that we're talking about, a lot of people don't even know that these are options for them, or that there are root causes, or that they can do anything. So I love that we can get this out there, just because there are so many people in my life that are suffering from these things, and it's great to be able to have a place to send them and be able to get them this information. So we've got another question here. Can you highlight some of the main symptoms of bipolar BPD?
Well, I don't even like to use diagnoses.
Yeah, okay.
Okay, that's a whole different model. That's the model that everybody listening here is probably following or have been in. You get diagnosed and labeled with bipolar. I could care less about that. If you went to see a professional, they could, like somebody who's like a psychiatrist or psychologist or even medical doctors, they'll have different tests that they'll have you do, or they'll ask you a series of questions. And based on your answers, they'll give you a diagnosis. But in general, for bipolar, typically people will have periods of feeling extremely happy and they're like, wow, like they can just take on the world, followed by a dip that's so low that they can barely get out of bed. Like, the sky has fallen, life is terrible. And what's interesting is that, it can be different time periods. People could go like 6 months in the manic phase or the happy phase, and then followed by another 6 months in the depressive phase. Or it could be even literally month to month or week to week. And there are a lot of different things that can cause that. And we mentioned some of them today, like environmental toxins, heavy metals, underlying infections, foods, but Lyme disease can do that. We've seen people having had diagnoses, like severe mental health diagnoses. And it turned out they had Lyme disease and a bunch of co-infections and heavy metals. And so we've literally saved some people's lives because we figured out what was going on with them. And they just so happen to have particular Lyme disease strains that are known to directly affect brain function. All right. And so, it's just really, really important to understand all the different causes. Another one can be Hashimoto's disease, and a lot of people go undiagnosed with Hashimoto's. It's an autoimmune disease that primarily affects the thyroid. And think about this. If your body's attacking its own thyroid, your thyroid hormones are going to be all over the road, right? And so is how you feel. You're going to go from feeling really good and everything's great, you're sleeping good, and your sex drive is great, you can focus, and then like literally the next day you can be like on the floor and the whole world is crashing in on you. And so again, having somebody who knows how to order these different kinds of labs, what kind of functional labs to order, which you cannot get from your regular medical doctor. It's not covered in that sick model of health. It's only this type of approach, by having someone who understands how to look at all the pieces and rule in or rule out what are the underlying causes. That's when you finally start to get answers and you can start putting a plan of action together to fix the problem for good.
I think that's an awesome response. I know so often that people are looking for like that one label. They feel down, they feel like hell, and they just know deep down something's wrong. They can't define it. And our system has been built upon defining that symptom and labeling it something, but then unfortunately, then just leaving it just where it is. So what Dr. V was just describing here about like almost not wanting to, and it's not because there's not the professional guidance and, and knowledge not to do it, but the moment that as practitioners, we label somebody, we've almost given them a piece of a disease. And I know that sounds odd because that's not how we're brought up. We're thinking, what's wrong with me? I need that label. Yeah, digging down, looking for that root cause, and then having a multifaceted approach. And listen, I started this off by saying you don't have to go out this alone. Like there's so many people like Dr. V here who have, put their life's work into these types of things that you'd be blown away by how much your life can shift in a very, very short period of time. And literally like you can heal yourself up, which is the beauty of this. And yet the truth is it can be overwhelming in the beginning when you look at so many things. And that's why you have professionals out there doing this type of work. All right. So that blew by. That was about the fastest hour I've been in a long period of time here. So Karen has a special question for you right here at the end here. So hopefully you're feeling smart. She's got a big question for you, and then we're going to close it up here.
Well, we are always trying to make health simple. So what we love to end on is there one action item that our listeners can take right away, one action they can take from this show to move them towards their goal of becoming superhuman?
Yeah, I would say set realistic expectations in your health journey And notice I said journey because it's not a destination, it's a journey. What your body needs is going to change throughout your life. And so what's good for you now isn't necessarily going to be what you need later. And realize that if you want to optimize and have superhuman health, you have to get back to a baseline of healthy first. And you got to set those realistic expectations that, you know, it could possibly take a year to 2 years to get there. Once you get there, though, it's all uphill from there.
Yeah, awesome. I love that. Well, thank you so much. We're going to link to your masterclass so everybody can get that amazing information. We so appreciate you being here. And yeah, thanks for talking with us today.
It's a pleasure. It was so good to get to talk to both of you. And hopefully let's jump back on soon.
Yeah. Hey, Dr. V, thank you. And I want to say thanks for being a crusader. And I know this journey that we take, it's not an easy journey. You take a lot of bumps and bruises along the way. So I thank you for having the courage and the guts to at times step up and, follow your passion. And in a weird way, I'm glad you had your story. I'm glad you had your experience so you can help thousands of lives now. So, and thank you for coming on tonight. And for all the listeners here tonight. So listen, if you or anyone you know has any challenges with mental health or brain stuff, whether from memory to a little here and there, don't leave it alone. Like this is, being superhuman means we got good working brains up there. So as usual, everyone, we're going to take deliberate action, right? For our mind, for the body, for your overall wellness. Y'all be awesome. Thank you, Dr. V. Appreciate you.
Thanks. Have a great day.